Welcome to Health Equity Talks. In today's episode, we're diving into a hidden health disparity no one is talking about. And that's how the fit lifestyle trend drives women towards eating disorders and the proactive steps that healthcare organizations can take to address this issue. Hi, I'm Tanisha, your host of Health Equity Talks, and on this channel, we help healthcare providers address implicit bias and promote health equity. And today, we'll explore the unintended consequences of the fit lifestyle and what you can do to make a difference. And stick around until the end because I'll share a resource that can help you promote genuine well-being in our fitness-obsessed world. But before we go there, let's talk about what's wrong with a fit lifestyle. The concept of a fit lifestyle is marketed as the epitome of health, but for many women, it becomes a difficult path to ED. I know because I had a very active yet hidden ED throughout the 6 years I've served in the Marine Corps. Because EDs can go unnoticed for a long time, it highlights that more visible health issues are often overshadowing this hidden health disparity. It also illustrates that the nuanced ways in which societal trends can impact health. The rise of the fit lifestyle is a prime example of how well-intentioned health advice can have unintended negative consequences. However, it also shows that not so well-intentioned advice can exacerbate health disparity. For instance, a common aspect of a fit lifestyle has been the overconsumption of energy drinks, especially amongst women. And one of the things that we should know is that high doses of caffeine in energy drinks can contribute to heart issues, which is troubling because heart disease is the leading cause of death for women in the United States. So while seemingly beneficial, a fit lifestyle can often mask unhealthy behaviors and lead to severe health consequences. Now, let's break this down into 3 key points. The first is societal pressures and perfectionism. The pressure to achieve an ideal body shape can lead to extreme behaviors, including excessive exercise and restrictive diet. I remember when I served in the Marine Corps, the body composition program was highly restricted to the point that many Marines were engaging in disordered eating behaviors to maintain our strict standards. Well, in 2022, Rand Health Quarterly published a study that confirmed the strict standards were driving women Marines and Marines of color to adopt disordered eating behaviors to meet the standards. Not that I needed the affirmation, but that study really highlighted the ways in which women and BIPOC populations are bombarded with unrealistic body standards. 2, the role of energy drinks and supplements. Now, energy drinks and supplements are supposed to supplement an already healthy diet. However, the problem is that the data shows that many women turn to energy drinks and dietary supplements to maintain their energy levels while restricting their calorie intake. And for those engaging in a very active lifestyle, this can be extremely dangerous for their health. Not only can this lead to destructive cycles of codependency, but it can also contribute to malnutrition because women aren't getting the vitamins and minerals that their bodies need. And 3, mental health implications. When we talk about disordered eating behaviors and EDs, we cannot ignore the impact that this will have on mental health. The pursuit of a fit lifestyle can have significant mental health repercussions, including anxiety, depression, and body dysmorphic disorder. As BDD entails in constant worrying about perceived effects in a person's appearance, it can contribute to further disordered eating behaviors. For instance, during my time in the Marine Corps, I wasn't just restricting calories, but I was also engaging in excessive exercise during my silent struggles with an ED. And because my disordered eating and exercise behaviors were keeping me within our body composition standards, it was easy to overlook that my routine was not as healthy as it was. Therefore, it's essential to recognize that BDD and EDs often go hand in hand. Now, understanding these critical points is important for health organizations who are committed to promoting health equity. And by recognizing the hidden dangers of a fit lifestyle, you can better support your patients and address a significant health disparity. And as promised, I wanted to share an invaluable resource with you, American Detox by Carrie Kelly. There are a few books that should be in every healthcare organization's educational arsenal, and this book is definitely at the top of the list. In American Detox, Kelly explores the pervasive impact of culture rooted in perfectionism, white supremacy, and individualism on our health and our well-being, and she really argues that true wellness extends beyond individual efforts. It requires a collective approach that addresses systemic issues. And by the end of this book, you're going to deeply understand how societal norms contribute to health disparities and have access to practical strategies for fostering a more inclusive, community-centered model of care. So make sure you check the link in the description to grab your copy today. Thank you so much for joining me in this important conversation. If you found this video helpful, like, subscribe, and share it with your colleagues. And don't forget to sign up for our weekly EDWH community newsletter to stay informed about the latest research and trends in healthcare equity. So check out the link in the description box below to subscribe.
Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.